Very safe and effective vaccines can help protect adults from a number of dangerous diseases: influenza, tetanus, diphtheria, pertussis, also known as whooping cough, pneumococcus causing pneumonia, varicella zoster virus causing shingles, and respiratory syncytial virus, or RSV. Each vaccine provides two important benefits. It can reduce your risk of infection, and if you do get infected, the vaccine reduces the severity of your symptoms so you don't get as sick. First, let's discuss a vaccine you probably already know: influenza or flu vaccine. The flu vaccine can reduce, but doesn't eliminate, your risk of getting infected with the influenza virus. Consider the flu vaccine like an umbrella in the rain. An umbrella can keep you dry, sometimes completely. But if it's raining very hard, an umbrella won't prevent you from getting hit by some rain. In the same way, the flu vaccine can help protect you from infection, but sometimes not completely. No vaccine is perfect. And because the flu virus changes so fast, we all need an updated flu vaccine every year. What's more, people who are older or have specific health conditions may also have weaker immune systems, so sometimes don't develop as much protection from vaccinations as they used to. Fortunately, there are 3 different enhanced flu vaccines specifically designed for people 65 and older to choose from. And like an umbrella that reduces how wet you get from the rain, a vaccine can also reduce your symptoms. You won't get as sick if you do get infected. Now, the downside of the flu vaccine, which you probably also know. Some people feel lousy after vaccination, but it's not the flu. It's your body's immune system building protection against influenza. And those reactions disappear by themselves within a few days. Way better than getting the flu. It's also possible to get infected before the vaccine takes effect, and the vaccine works for many, but not for everyone. Are there serious life-threatening side effects from the flu vaccine? Yes, but they are extremely rare. How rare? Imagine a football stadium filled with 70,000 adults. If everyone in the stadium got the flu vaccine, it would take more than 5 completely filled stadiums of people for one person to have a serious side effect from the vaccine. Now, how does that compare to the risk of complications from flu disease? Imagine again one stadium completely filled with 70,000 unvaccinated people. In an average year, over 6,000 would get the flu. Of these, about 230 would end up in the hospital, and 23 would die. But if these people had been vaccinated, in an average year there'd be about 3,800 cases of flu, 140 hospitalizations, and 14 deaths. So flu vaccines protect most people most of the time. Because people who have had flu in previous years can get it again, choosing to get a flu vaccine every year helps provide protection. Now another vaccine available to all adults: Tdap. Tdap stands for tetanus, diphtheria, and acellular pertussis, also known as whooping cough. These bacterial diseases used to be common and are now much less so because of vaccines. But they are still around, and whooping cough is making a comeback as outbreaks continue to occur, especially among unvaccinated people or those not up to date on pertussis vaccine. Because immunity decreases over time, all adults are recommended to get a Tdap or TD vaccine once every 10 years to stay protected. Now, another vaccine available to adults 65 and older: pneumococcal vaccine. Pneumococcus is a bacteria that can cause many types of serious disease, including pneumonia, which can be deadly, especially in older adults. Now, another vaccine available to adults 50 and older: shingles vaccine. Shingles is caused by a reawakening of the varicella, or chickenpox virus, that lingers in our bodies. So if you had chickenpox as a kid, you are at risk of shingles as an older adult. 1 out of 3 adults will get shingles. Shingles causes a rash of blisters across your body, which can be itchy and very painful. Sometimes debilitating pain persists long after the rash disappears. And finally, one more vaccine available to adults 60 and older: respiratory syncytial virus, abbreviated as RSV. RSV is a very contagious virus that infects the lungs. RSV can cause pneumonia, which can be deadly, especially in older adults. How much do RSV vaccines protect against severe RSV disease? Imagine again one stadium completely filled with 70,000 unvaccinated people over 65. In an average year, about 115 would end up in the hospital with severe RSV disease. But if all these people had been vaccinated, in an average year there'd be about 7 such hospitalizations. Very safe and effective vaccines are available to help protect you against all these diseases. If you choose to get vaccinated, you are also less likely to pass these diseases on to those around you. This is important because diseases like influenza and whooping cough can be especially dangerous for older adults, pregnant women, babies, and people with underlying health conditions.